Hello, my name is Anna Brady. I'm the Nursing and Midwifery Sustainability Lead, and I'm leading the Future of Health and Social Care project. This project is implemented by the Center for Sustainable Healthcare and is funded by the Burdett Trust for Nursing. You can find more information on our website. Let's start with some basic information about the courses provided by the project. Our courses are available for any registered nurse or midwife worldwide. It doesn't matter where you are registered, you can attend the courses. They're also fully funded for registered nurses and midwives. And this means that usually the courses at CSH have a price attached to them for everybody attending. But for these courses, the Burdett Trust for Nursing is funding these places for any registered nurse. You can book any individual place for the course on our website, and the full course is virtual. If you would like to book for a group in your organization, you can just contact us and we can arrange a group booking as well. The courses are not just courses, but they're also helping you become part of a community of practice and gain ongoing support, which does not stop with the last webinar in your course. We've got 3 courses available at the moment for nurses and midwives. The first course is Sustainable Innovation for Nurses and Midwives, and this course is aimed at frontline nurses and midwives, and it is open to nursing and midwifery students as well. But it is not only useful for frontline nurses and midwives, it's also useful for anyone looking for a strong foundation and support with project planning. So if you would like to learn the foundations of planetary health and find out which project you could do in your work environment, then this is the right course for you. The second course, Sustainability Analysis and QI in Nursing and Midwifery, is delivered for specialist service leads and team leads, but it is also open to anyone wanting to apply SUSQI methodology, so Sustainability and Quality Improvement methodology, to a project idea. You don't have to have done the first course to attend the second course, but if you have never had any kind of education in planetary health and you don't quite know what project you want to implement, then I would encourage you to do the first course first. The third course is a little bit different. This one, Sustainable Innovation Leadership for Senior Nurses and Midwives, is only for board and executive level senior colleagues. And we are vetting any application to the course very closely and make sure that everybody is at the right level to attend this course. A little bit more information about the first course. Sustainable Innovation for Nurses and Midwives is divided into 3 parts. The first part is self-study online through our online learning platform, where we have 8 hours of pre-webinar learning that is mandatory, but there is a lot more material that you can look into with links to further reading and the sources. The second part of it is the live webinar online, where we have a 2-hour workshop where we work with you through the project's ideas that you have developed while reading the self-study material, and help you decide which one will have the biggest impact and which one is the most feasible to implement for you. It will also help you start the first steps of implementing a project and plan already ahead for measuring the success. The third part of it is mentoring and connecting. So we encourage you to stay in touch after the course and either join the Nursing and Midwifery Sustainability Network or some of our other networks as well. We have specialty networks where we have monthly meetings with more information, with more ability to connect with others working in sustainable nursing and midwifery. We also offer sustainable healthcare cafes only to the alumni of this course, which are 1 hour long and about every 3 months. And these are meetings where you can just drop in and ask your questions to our team of specialists and facilitators, so that after the end of the course, you will be able to gain ongoing support for the implementation of your project. Like I said, the learning outcomes are learning these theoretical foundations of planetary health and health sector vulnerability and sustainability, but also the practical ability to identify and assess opportunities for sustainable innovation in your practice, and to apply the basics of SASQI methodology to plan, implement, and measure the impact of a sustainability-focused improvement project. As an outcome of the course, you will have a project plan. We will give you a template to fill out, and you will also have a reflective practice journal that you can use for NMC revalidation. The second course, Sustainability Analysis and QI in Nursing and Midwifery, is also divided in 3 parts. The first part, self-study online, is a little bit shorter with 6 hours of mandatory pre-workshop learning. However, there is the foundational material of the first course available as well, which you can do optionally, and some optional learning materials on carbon footprinting as well. The live workshop online is in very small groups with a maximum of 10 participants per facilitator, so we can give you individual support with your projects. And the workshop itself is 4 hours long. After the workshop, we encourage you to connect with us either through the network, so the Nursing and Midwifery Sustainability Network, like the first course, but you can also join the work in progress meetings, which are specifically for the alumni of this course. And they're also happening about every 3 months, where you can just drop in very informally and ask us questions and get help with the ongoing projects. The learning outcomes are the foundations of planetary health and health system sustainability and vulnerability, similarly to the first course. But here, it is less about finding the right project to implement and getting an idea of where the opportunities are, and more about applying SASQI methodology and quality improvement tools for a sustainability-focused improvement project. You will also learn to apply the basics of carbon footprinting to measure the outcomes of your project. The results are similar to the first one, a project plan and a reflective practice journal that you can use for your revalidation. The third course, Sustainable Innovation Leadership for Senior Nurses and Midwives, is a little different from the first 2 courses. It is less focused around teaching you things and more focused around giving you the opportunity to network with peers. The course is also divided in 3 parts with an online pre-workshop briefing that we also send as a document to your email address. And we also give you access to our online learning platform where you can have additional optional material for learning. The second part is the live workshop online, where you will meet and discuss for 2 hours. We have a very high-level senior facilitators for this course who will be able to help you if you're working on a very senior level to find good ideas on how to lead the sustainability transformation. There is also some connection and support available, where for every cohort, we have 1 follow-up session 3 months after the workshop. The briefing includes a summary of planetary health, health system vulnerability, and healthcare sustainability. And the workshop is discussion-based and focuses around leading yourself, leading others, and leading the system. Thank you very much. If you've got any questions, don't hesitate to contact me under anna.brady@sustainablehealthcare.org.uk.